Welcome back to You Heard It Here with Dr. Gary. This is earwax removal vlog number 89. In today's episode, we're going to take a look at an earwax removal that we were just not able to complete. This patient had a very interesting story when they came in to see us, and when I looked in this ear, I did not think that this was going to be a big deal. As you can see, I can already see part of the eardrum, which is much better than what I deal with most of the time when I'm doing these earwax removals. Sometimes the wax comes out in one giant chunk, and other times it is like a hot knife through butter and just won't come out. This patient was recently seen by their ear, nose, and throat specialist who used microsuction to remove some of the wax from this ear, but was unable to complete the wax removal. When they told me that, I was a little bit surprised because microsuction would normally do a great job with this type of textured wax where it's very tacky. So as we look down and we can see the eardrum, I start to notice some little things that are concerning. One, down by the eardrum, it appears to be a little bit of an abnormal anatomical shape. Second, this wax doesn't appear to be on the ear canal wall. It appears to almost be inside the ear canal wall. This led to several questions. We talked to the patient to make sure that the patient did not have history of outer ear surgery, no history of mastoid infections, or mastoidectomy. They reported none of this. There were also nothing in the notes from the ENT about any of that either. So what we're going to do is we're going to use the curette to try to massage and pull that wax gently off of the ear canal wall and out of this, I guess we'll call it a pit on the side of the ear canal, to try to get the best view for the ENT for when we send them back to try to get any additional diagnoses done. As you can see, this wax is just lodged in there. It just does not want to move. We're getting it to come out with some chunks, but overall that wax is really just stuck in this little pit. If you like these wax removal videos, please take a moment to like and subscribe. They really do help with the YouTube algorithm, help get this content in front of more people, and it really does kind of promote us doing this and keeps me motivated to move forward. Alright, so now I can see that all the way down to the eardrum, again, there does appear to be some discoloration and that abnormal anatomical structure, both in the ear canal and down by the eardrum. Definite referral back to the ENT. Again, we're being very gentle. We're just seeing if we can massage and kind of move this wax, coax it off the skin here, and bring it down so it comes out so we can get a good view for the ENT. It is just going to fight with us the whole time. At some point, you just have to call it and say, we're not going to do anything. Now, sometimes it just doesn't work. In this patient's case, we did not want to use irrigation because, as I've said in many of my videos, irrigation is fine if the ear canal is healthy and normal anatomical structure. In this case, there appears to be something abnormal, so we're not going to do the irrigation. We just left it alone. We got the majority of that wax out so the ENT could see the abnormal anatomical structure down by the eardrum and could see clearly that that wax was coming out of the ear canal wall rather than just being stuck to the side of it. So we switched to the other ear. Here we see all of the anatomical structure within the ear canal appears to be very normal. Nothing major, just some wax. We're going to get that removed, get a great view of the eardrum, and that's really all we needed to do on that side. Thanks for watching. This has been You Heard It Here with Dr. Gary. If there's anything else you think you'd like to see in future videos, please leave a note in the comments section below. I'll do my best to respond. Thanks for watching. See you in the next video.